Thanks for coming back. If you recall from the first video, my name's Aaron Furman, and I am living with a rare idiopathic genetic liver disease. Technically, it's a disease of the bile ducts, not the liver, but we'll go into that later. So, picking up where we left off. When life changes overnight, you don't just lose the life you had, you are forced to learn kind of a new language. A language of labs, of scans, of acronyms that you've never heard before. For me, that word was PSC. There's other acronyms in there as well, but that was the big one. Primary Sclerosing Cholangitis. Sounds a lot like medical jargon, because it is. Even most doctors only know it in passing, but it's not just a phrase on a chart. It's the reality that has rewritten every part of my life. So let's strip that down. What does PSC actually mean? And what does it feel like when you're the one living with it? PSC, as I said, is Primary Sclerosing Cholangitis. I spell it wrong almost every time that I write it down. It's a chronic, progressive liver disease. Technically, it's more a bile duct disease. What that means in plain English is this: the plumbing inside of my liver, the bile ducts that carry the waste out, have started to slowly scar. They've narrowed. They, about once every 6 months, they clog. Doctors call this fibrosis, and you'll hear things like strictures. On imaging, an MRCP, which is pretty much an MRI, will often show something called biliary beading, meaning your bile duct looks like a pearl necklace. It's insane. But that biliary beading is what is going to get you sent to a hepatologist specialist, because that biliary beading is what a general surgeon and a radiologist and an ED doctor, that's how they're going to know that you have something called PSC. Here's what that means in real life. Your bile ducts are backed up, waste can't get out, pressure builds, and over time that scarring literally wreaks havoc on your liver itself. Sometimes you even develop what's literally called bile sludge. That's an actual medical term. If you're lucky, you are with a doctor who is familiar with the disease, but most aren't. You'll get, if you're very lucky, again, a doctor will set you up with a team that understands what you're going through, the challenges, and they'll send you in for a simple 20-minute procedure called an ERCP. Essentially, they knock you out, go down your throat, intubate you, find a way up into the liver. It's all very complicated. I've had some pretty wonderful surgeons like Dr. Wani go in and routinely clear out my liver. This doesn't cure me, to be clear, but it just buys me another chance at fighting the infection, for me, that shows up like clockwork. Now, not everybody is like that. I know people that have had PSC for years who have never had an ERCP. I seem to go in every 6 months. Sometimes I go in, they put a stent in, which is essentially a long, thin piece of plastic that keeps your biliary canal from collapsing on itself. It allows bile to flow. Sometimes they take it out and they literally put a new one right back in. Actually, let me say this. I hope for your sake you have a Dr. Wani or a Dr. Shaw. Doctors who don't just treat the disease, but who know how to steady the room. Because when an ERCP isn't routine anymore, when that simple procedure, in your case, has turned into chaos, it's not just you carrying that weight, it's your partner or your family too. And the good ones know this. They prepare their team. They look your partner is in the eye. They hug her. They say things like, everyone here knows their roles. And in that moment, she can swallow the tears, take a breath, smile. And if, God forbid, that smile was the last memory you carried with you into that surgical room, procedure room, it would be a good one for you to hold on to. But doctors are also going to tell you things like PSC is immune-mediated. That means your immune system, the very thing designed to protect you, is also attacking you. It's attacking your bile ducts for reasons medicine still doesn't fully understand. It's linked with other autoimmune diseases, especially things like ulcerative colitis. I think it's like 70 to 80% of PSC patients also live with IBD. That's a clinical reality that you need to accept. Somehow I've avoided UC and IBD. I don't know how. But here's my reality, and it's the reality for most people living with PSC. You're going to experience bone-deep fatigue. I can't stress that enough. Fatigue that becomes your baseline. At times, you are going to experience relentless itching that makes you want to crawl out of your skin. At the worst times, you're going to have something called jaundice, where your body literally turns yellowish orange. A lot of times, you're going to have gut pain. Gut pain that doesn't add up. For me, I get it when I'm trying to run and stay healthy. Literally, if I push it too hard, I break out into like a rash on my lower right quadrant where my liver is. It's kind of like this burning itch right over my liver. That's my body's way of saying, stand down. But then there's other things. There's brain fog. I just learned about this. It's not that funny kind of brain fog where you forget somebody's name or you lose your keys. This is different. This is your brain short-circuiting. It feels like your own body is gaslighting you. At first, you don't even notice it, but people around you do. You know what you want to say, you can picture it in your head, but the connection to the words just won't fire. You kind of lose a thread mid-sentence, you forget things you've known forever. PSC literally steals chunks of your clarity, and you're left staring into this hole. There's other things with PSC. I remember like the textbooks are going to tell you PSC increases your risk of cancer. They are going to have cancer tests that they run on you, and sometimes they're going to be real high, and you're going to notice a trending chart, and it fluctuates. I can't tell you not to be scared of that because cancer is a big word. Here's what I will say. Talk to your doctor. And if they're not explaining in a way that you walk out of that room feeling comfortable, then you need a new care provider. But bile duct cancer is real. Gallbladder cancer is real. Liver cancer is real. Colorectal cancer, if you've got IBD, that's real too. It can progress slowly, or it can take you fast. Some patients live stable for years. Others more rapidly towards cirrhosis and liver failure. I think the average survival without a transplant is quoted at 10 to 20 years. But that's just a number. I promise you it's going to change. When I was first diagnosed, my MELD score was somewhere near 30. They told my partner I had about 48 hours to live. That's hard. You have to learn to deal with that uncertainty. And there is no silver bullet for this. There is no remedy. What it feels like as a patient living with PSC, the same. There's no cure. there's no therapy. Literally none. So you do what most people do. You start looking because, again, there's no cure, there's no therapy, there's nothing. You look beyond your medical team because deep down you still believe doctors are omnipotent, and if they can't cure it, if they don't know the answers, maybe somebody else does. If you think to yourself, if they can heal a broken bone, if they can transplant a heart, then surely there must be something out there for this. And if modern medicine doesn't have that answer, who knows? Maybe nature does. That's when that Google algorithm kicks in. Suddenly, your search history becomes your treatment plan. Cannabis for pain and tissue growth management, mushrooms for brain fog solutions. One podcast says CBD is the future. Another swears that psilocybin is the answer for the brain fog because it reconnects synapses in your brain. Instagram posts are going to promise clarity, peace, healing, all through plants. It is very seductive when you're first diagnosed, because that seems to be when you're the most susceptible. That's when you're desperate. Because when you're desperate, every headline looks like a lifeline. But then reality sets in. Yes, THC can absolutely take the edge off the pain. But CBD, cannabidiol, which is often in that same plant where you get the THC, CBD, that one's going to raise your liver enzymes, and you don't want that. So you got to be careful there. Mushrooms for brain fog, that's where it gets dangerous, because with PSC, you got to remember your body no longer has its natural filter. Those capsules, those powders, you don't really know where they came from. You don't know what was sprayed on them. Even when the label says organic, you start to wonder, what does this even mean for me? So you stop, you pause, you kind of remember your doctor's warning, use caution. And in the end, you stick to what you can trust. Pharmaceuticals. I know it sounds weird. Not because they're perfect, not because they're offering a cure, but because at least they come with safeguards, with manufacturing standards, with some baseline of safety. And by the way, if you're sitting there talking about vaccines and how Bill Gates is going to get into your brain and steal your bank accounts, maybe this isn't the best video for you, because we're here dealing with reality, and these are last minute things, so we need to be sensible. Going back, eventually you get to the part where a doctor comes up with a treatment plan. If you're lucky, you'll find a doctor who knows PSC, the PSC landscape. They'll prescribe you most likely something called ursidile. It's a drug meant to break up the stones, literally biliary stones, clogging your bile ducts. Speaking specifically on ursidile and the PSC circles that I run in, the verdict is almost always the same. It hasn't hurt, but I don't necessarily know if it's helped. That right there is the bar with PSC. Eventually you're going to come across the cholangitis attack. Hopefully you don't, but I'm guessing you will. You'll get pain meds, enough to dull the agony of the infection that's killing your liver. And in that haze, you realize something absolutely terrifying. When you've been numbed from pain, you realize you've been living with a numbing pain, a grinding pain all along. Literally for months or years. Your body just got used to it. You just didn't notice it until it was actually gone. If you're at that point, there's going to be antibiotics, Cipro, you name it. There's a ton of them. Some go into a PICC line into your heart. Some are oral. Some go into an IV. A lot of times you're doing all of them at the same time. You'll take so many antibiotics that your mouth tastes like a copper penny for weeks. At that point, you're probably going to be having some creams for the itch, some pills for the anxiety. But here's the thing. The hospital doesn't heal you. It tries. It deals with the infection. But if I'm being honest, the hospital is going to break you down. You'll lie in that bed. Personally, that has no business being called a bed because you find zero rest in it. You're going to eat food designed to keep you alive, not really give you joy. You'll be woken literally every single hour for vitals, for blood draws, for medication. Also, a surgeon has your data for their morning rounds. Peace doesn't exist in the hospital. It is strictly survival. So, when they finally let you out of that hospital room, you are going to fight to stay out of that hospital room for the future. So, you're going to do some things. You're going to finally swear off alcohol. And if you haven't yet, smarten up. You are going to stop doing drugs. And if you haven't yet, smarten up. You are going to eat clean. You are going to try to exercise, not because it makes you feel better, but because you know you'll need your strength to survive that next day. That's a weird one. But you are going to cling to the memory of who you used to be when you could do all those things like exercise easily. Me, for example, I used to spend every waking minute when I wasn't working rock climbing. I could climb 513 pretty steadily. I live in the Colorado Rockies. I would ride hundreds of miles of single track on my mountain bike or my road bike literally weekly. I had my routines. Actually, looking at my board, I miss doing those routines. I don't do them anymore because it's hard. Some days I have to bargain with myself just to stand up off the couch. And after every single hospital stay, this disease slowly takes a little bit more. Your muscles begin to waste away every day that you're in that stupid bed. And then you try to claw your way back to what you were, your baseline before that hospital stay. For me, it's an 8-minute mile, meaning I could go to the track and I can run a mile in 8 minutes. It's not great. It's not bad. It's mine. An 8-minute mile when you're out of shape, for me, takes discipline over the course of months. It means going to the gym. It means jumping on the treadmill. It means running around the creek on the bike path. Here was a lesson that I came to terms with. And I'm in therapy for the following. When you're trying to get your 8-minute mile for the 10th time in 4 years, you begin to ask yourself, is it worth it? Because you know that the next attack is going to strip it all away again, and you're going to be starting fresh. Think about that. Usually when you go to the gym, you have goals, you achieve them, and you move on. But what do you do when your goal's the same thing every single time and you don't see the reward? With PSC, there's no reward for working harder. There's no progress bar to fill. There's only the chance, the hope, to reset, to redo, to try it again. And that is where PSC management starts. In medical terms, PSC management sounds straightforward. Surveillance, monitoring, regular imaging, endoscopic dilation, stenting of strictures, symptom control, itch, fatigue, infections. And when the liver finally fails transplant, the only life-extending treatment is a transplant, apparently. Even then, though, PSC can come back in a new liver. All of that sounds simple on paper. It's no longer 8-minute miles and getting ready for that. It's literally learning how to put a progress bar on your life. But what it means in practice is it's harder. When you think about it, transplant isn't the finish line. That's kind of a starting point. Twice a day, every day, anti-rejection medication for the rest of your life. Miss one dose just once, and your body can literally spiral into rejecting that liver. Years later, it's a foreign body. Your body does not want it in there. And here's the cruel irony. PSC isn't a disease of the liver. Like I said, it's a disease of the bile duct, which means even after a transplant, there's a, and don't quote me on this, but a 30% chance that your disease comes back and contaminates that healthy liver. But that's not even the scariest part, because for me, every time there's a congressional debate on Obamacare and I have fears of my pre-existing condition on the table, I'm fearful of my access to care. It's to the point where it's debated daily. It's a talking point. You start looking at those costs. The first time I came out of the hospital, it was millions of dollars. Those costs are relentless. They're as relentless as the disease itself. Meds, labs, scans. It's a cycle that literally never stops. So here's a modern summary, both medical and personal, of what I went over in this video. PSC is rare. It's an immune disease that kind of relentlessly scars your bile ducts. It disrupts bile flow. It puts you on a path towards cirrhosis, liver failure, maybe cancer. It's unpredictable. It's difficult to treat. It is absolutely life-altering, not just for the patient, but for the family, the caregiver. On paper, it has a simple term, PSC. In real life, it's a fight every single day. And here's what that fight looked like for me just in the last month. Yesterday, a visit to hepatology. Another new prescription for antibiotics. Not because I'm actually sick or having a fever, but as a precaution, a safety net, because I fly a lot for work. So what happens if I am overseas and I have a cholangitis outbreak? I need to get home to Denver. I need to get to my doctor. I need to control the infection. So I carry antibiotics in my case. Because if I step on a plane and that infection hits midair, I need a lifeline, something that can hold me long enough to get back to Denver before it pulls me somewhere darker. Then there's the labs. Routinely, a lipid panel, they call it, but for me, each draw is not routine. Each draw is a question. Is my body holding up? Am I slipping? There's those thyroid stimulating hormone tests, because fatigue isn't enough. Now we're checking if another organ system is actually failing. Typical blood draws are hemoglobin A1/6, blood sugar, because PSC doesn't travel alone. It drags other risks into the room. You have full hepatic function panels. It's essentially a scorecard for my liver. Numbers that never let me forget that this thing is progressing. There's often cancer antigen. I think it's 19.9. Literally, you do it so often that I remember these things. It's a marker for bile duct cancer. Every test is almost like a quiet countdown. Not if, but when. You get a CBC, which is a basic metabolic panel. But for me, it's not basic. Every number is kind of a potential red flag. We have a Excel spreadsheet that charts all the way back to when I was first diagnosed, and we watch the trends. Then there's the everyday stuff. An upset stomach or an itch. My partner worries. Is this another cholangitis attack? I end up calming her down even when I'm questioning it myself. Or there's the wedding, the family gathering, everyone in one place, and the questions never stop. How are you? Can you eat this? Are you tired? Are you... It just keeps going. But then there's the big ones. For me, an ERCP, a camera, scope, instruments threaded inside me to clear blockages, to dilate strictures, to put stents in. I currently, right now, had a stent pulled 40 days ago. And I was supposed to be clear, and I wanted to go for a bike ride and go rock climbing. But with PSC, a stent is different than somebody without PSC, because when they put a stent in with PSC, you have severe scarring, so that stent moves. And when you're crouched over on a bike, you can feel it move sometimes, especially if you're doing long rides. When you take a whipper when you're rock climbing, you feel it. When you are flying on a plane and somebody's in a rush and they elbow you in the stomach, you feel it. So stents are a little bit different for PSC as well. There are surgical pathology requests because they don't just look, they cut, they sample, they search for cancer. There is, I think they call it pancreobiliary. I know they call it a fish. It's kind of this genetic testing of my bile duct cells, which means they're hunting for mutations that could tip into malignancy. And none of this is theory. That's not abstract. That's my month. That's my calendar. That's my life. So when you hear management of PSC, know this. It's not just a list of bullet points in a medical journal. It's blood draws, scopes, procedures stacked on top of each other. It's living in 3-month cycles, 3-month increments, waiting for the next scan, the next lab, the next call from your care team. On paper, it's management. In practice, it's endurance. And it's hard. You've heard me say it before. This disease is hard. If you haven't heard me say it before, I'll say it again. What you're living with, what you're dealing with, it's hard. Don't let anybody else tell you that it's not. It is a very hard disease. So until next time, I appreciate you joining my story. And please remember, these tidbits are my journey with PSC. They may not be yours. What I'm saying may scare you. You may have just learned about it just like I did, and you did a Google search and it scared the heck out of you, what you read. But this was my disease. I've talked with people that haven't experienced anything. That's the hard thing about this disease. You don't know what it's going to be. It's unique for each person, and that's what makes it hard. Even with a team, even with a care team, even with a loving partner, even with a caring family, even with PSC partners in the community that they've created. Oh yeah, if I haven't mentioned PSC partners, that should be your next stop, PSC partners. If you have money, or you come from money, or you have some extra funding, or you won the lottery, they are one of the only teams, if not the only team, that's progressing this disease. And they are the ones that are going to cure it. They're the ones that are going to find a therapy for you. They're the ones that are going to make it so we are no longer talking about 5 years, 10 years down the road when they need to take your liver and they need to call somebody in from your family that has similar genetics as a living donor, or you are worst case put on a list where you were waiting for a deceased donor. They are the ones that are going to solve this puzzle. So if you can, every penny counts. And they do a good job. But I'm not here to promote PSC partners. I'm just saying you need community because this is hard. And in many ways, you're alone. Because not everybody's dealing with the same thing you are. All right, thank you.